Good afternoon, and welcome to HBU's Healthy Campus podcast. We're your hosts, Victoria Shea, Allison Taylor, and today we're going to be discussing left-sided heart failure. We chose this topic because we believe that students at HBU are at the perfect age to start taking action in preventing this disease. We are young, we have access to a health and fitness center, and we are currently forming our lifelong habits. The dietary choices and exercise plans we choose today will make a huge impact on who we are tomorrow.
Into more about
So, Allison, could you tell us a little bit about heart failure?
I can, Victoria. Before I dive into more about heart failure, I just want to say that it is a major disease in the United States. About 5 million people are diagnosed with heart failure, and the rates are just steadily increasing. By a book definition, heart failure is the inadequate pumping or filling of the heart. Why, you may ask yourself, what does this mean? Let me explain it to you in another way. Think of your body as the car. The engine of the car is your heart, and the gas is your blood. In a car, the gas has to go from the gas tank to the engine for the car to move. When there is difficulties getting the gas from the gas tank to the engine, the car does not function properly. This is like the heart not filling properly, which leads to the heart failure. To talk more about the risk factors and signs and symptoms of heart failure, we're going to shoot to Derek. Derek, we gotcha? All right.
Thanks, Allison. You're here with Derek Shelton for this week's Q&A session of the Healthy Campus broadcast at Houston Baptist University. This week, we're discussing the topic of left-sided heart failure. So without further ado, let's go ahead and kick off this week's Q&A session on left-sided heart failure. Question number 1 from Paul M. Paul writes, my grandfather had heart failure, and I'm worried that it's genetic. Am I at risk? What are the risk factors? Hello, Paul. That's a great question. The short answer is yes, you are at risk, and I can say so by identifying two identifiers here in your email. One of those risk factors is the fact that you are a male, and that is considered to be a risk factor for heart failure. Another risk factor that I've identified here in your email is that you have a family history of heart failure, and yes, that is considered to be a risk factor as well. Let's go ahead and answer your question. What are those risk factors for left-sided heart failure? So, the two main culprits or two main risk factors for left-sided heart failure are hypertension and coronary artery disease, okay? Some of the other risk factors of left-sided heart failure include advancing age. By advancing age, I mean the geriatric population, so really, age 65 and older. Other risk factors include diabetes, smoking, alcohol abuse, drug abuse, obesity, high cholesterol, rheumatic heart disease. We have myocarditis. Another reason is anemia, dysrhythmias, bacterial endocarditis, pulmonary embolism, and even nutritional deficiencies. That's a great question. Question number 2 is from our next emailer, George W. George writes, hello HBU nursing students. What are the signs and symptoms of left-sided heart failure? Okay, so remember we're dealing with left-sided heart failure here, so we're going to be talking only of the signs and symptoms of left-sided heart failure. And those signs and symptoms include, but are not limited to, weakness, fatigue, anxiety, restlessness, confusion, depression, weight changes, especially a drop in weight, shortness of breath, shortness of breath when lying down flat. That's another indication of possible left-sided heart failure. Dry hacking cough is another one. Fluid in the lungs. Another sign and symptom is what we call the S3 and S4 heart sounds. We'll use a stethoscope to listen to your heart, and if we are able to identify S3 and S4 sounds, that could be a possible indication of left-sided heart failure. And then one more sign and symptom that I would like to go ahead and mention is what we call alternating pulses. So if your pulse, let's say, it kind of fluctuates from going strong to weak, that is a possible sign of heart failure. All right, question number 3 is from Marshall M. Marshall asks, how is this diagnosed? Are there any tests that can be done to diagnose whether or not you have heart failure? Diagnosing heart failure can be tricky because the signs and symptoms are not always specific to the condition itself, but let's go ahead and get into that. Possible tests that your healthcare provider might use to diagnose whether or not you have heart failure. Those include a history and physical examination, a chest x-ray, they might do some blood work, they can do what's called a heart catheterization, they can do a urinalysis, they can do a biopsy. They can also do exercise stress testing. And by exercise stress testing, they're going to go ahead and purposely elevate your heart rate and then take a look at the electrical activity of your heart. The last test that they may or may not do is electrocardiography. and this is a great test. It's actually considered to be the best test at diagnosing whether or not you have heart failure. And the great news is that it's actually minimally invasive, so that's good for you. You should not expect any pain with that test. That's a good question, Marshall. Thank you. Question number 4 is from Patricia D. Patricia D wants to know, what complications can arise from having heart failure? Well, Patricia, actually that's a good question. There's several possible complications that may or may not manifest with the presence of heart failure. So one thing that you may or may not see is a rapid weight loss. We do see that in patients with left-sided heart failure. Another thing that you might see is life-threatening arrhythmias, and so those are basically situations where your heart rhythm is not, it's without rhythm. It's not in the rhythm that it's supposed to be in. Another complication can be angina, which is a fancy way of saying chest pain. Another one is myocardial infarction, which is it's a fancy way of saying a heart attack. Another complication that we sometimes see in patients with heart failure is depression. And then we may also see impaired kidney function and or impaired liver function. The last thing that we often see in patients with left-sided heart failure is going to be fluid buildup in their lungs, which is basically also known as a congestion. And that simply happens because when the left side of the heart stops working the way that it's supposed to work, the fluid backs up, and the only place where it can go is back to the lungs. So we often see that, and in fact that's part of one of the signs and symptoms that we mentioned earlier. So that's a good question. Thank you for asking that, Patricia. All right, question number 5 is our last question, and it comes from Jennifer B. Jennifer B writes, heart failure seems pretty common in older people. Can we prevent heart failure? If so, how? Jennifer, that's a fantastic question. Actually, prevention is probably my favorite area as it relates to the various disease processes that are out there. It's a hugely important thing to understand. In fact, we're dumping more and more time and resources and money into the area of prevention. And the good news is that prevention is an area where the patient has such a play in it, and you do have a say in it. So let's get into that. What are some ways that we can prevent left-sided heart failure? Well, number 1 is going to be if you smoke, quit smoking. It's that simple. Smoking has been identified as a key component or a key cause in so many different disease processes and so many conditions. And so I highly encourage you to quit smoking. If you need any help, there's so many resources that are out there. There's smoking cessation programs and classes and literature. You can go in and speak to your healthcare provider. You can tell him or her that you want to quit smoking. They can give you some great advice and tips, and they may even go ahead and prescribe you some medication to help you achieve the goal of quitting smoking. And I encourage you to do so today. Don't wait till tomorrow. Do so today. And that leads into my next thing that I want to get into, the importance of today. Time is a huge factor with prevention. As a healthcare professional, I view time as the same way that a financial advisor or an investor views time. So our bodies, our health, those are investments. And so time is a huge factor. The sooner that we make those healthy lifestyle choices, those changes in our lives, the sooner that we do so, the more impact that we have on our future, the better impact that we have on our future. The third thing that we can do to help prevent the onset of left-sided heart failure is in the area of nutrition and diet. So if you're deficient in the area of nutrition, then I encourage you to go out there and learn more about it. We will be covering nutrition here soon in one of our weekly broadcasts. Another thing that you can do is there's so much information out there, so you can go out there and you can go on the internet, you can research healthy diets. The fourth thing that you can go ahead and do is you can increase your activity level. And what I mean by increasing your activity level, I essentially really am meaning exercise. However, I know that some of you don't exercise. In fact, some of you might not have exercised in years or even decades. And so that's why I encourage what I call the crawl, walk, run method. So you'll start out slowly and you'll build yourself up to a level of fitness that is conducive to having a healthy heart. And so that's what I mean by crawl, walk, and run. What we eventually would like to see is for you to be exercising 5 days a week at about 30 minutes each session. As with the other things that I mentioned, I highly encourage you to go in and speak to your healthcare provider about incorporating a fitness routine. Your healthcare provider is going to have a great or better understanding of your current level of health, and they're going to be able to go ahead and point you in the right direction and go ahead and give you some advice and tips to help you achieve that goal. Also, if you're abusing alcohol or drugs, I think it goes without saying that you need to go ahead and stop doing so. It is an area that you can try to manage or control that directly influences the health of your heart. So this week's broadcast is over left-sided heart failure. I hope we answered all of your questions. At this time, I'm going to go ahead and turn it back over to Allison. I really appreciate all of your questions, and I hope that you get on with making those necessary lifestyle choices that are going to help you have a healthier heart and thus a healthier life. So back to you, Allison. Thank you very much.
Thank you, Karina. And now we're going to discuss what it's like living with heart failure. There are many resources you can utilize that help you physically, mentally, emotionally, and spiritually. First, we're going to talk about an evidence-based practice study that I came upon. In this study, it deals with patients who are diagnosed with heart failure and they're receiving IV diuretic therapy in the home setting. The criteria to be admitted in this study was that you had to have confirmed heart failure with an echocardiogram, symptoms of breathlessness and fatigue, preferred care at home, and fluid overload. The patients were given IV Lasix, and to backtrack, heart failure is a chronic condition. So once you're diagnosed with heart failure, it is something that you have to maintain and manage. It is not an acute illness that you can go and cure with one hospitalization. People with heart failure often have frequent hospitalizations. So this study aimed at giving patients the therapy that they would get in the hospital setting in a home setting. The study concluded that the services in the home setting were effective in reducing hospitalization visits.
Next, we will be discussing the rehab services and the financial burden associated with heart failure. Rehab facilities are very helpful in exercise training and teaching energy conserving and energy efficient behaviors. Physical and occupational therapists will create a plan customized for you. These facilities will help you manage your heart failure and continue living your life. There are counselors provided that can help you in any part of this process, including the financial needs. The financial burden of medications and other resources can be heavy. 1 to 2% of all healthcare expenditures are devoted to heart failure. $38 billion has been spent on patients with chronic heart failure. This is an astounding number that we hope we can reduce. There are thousands of rehab facilities located across the nation, and if you would like to find out more information or if you would like to find a facility near you, you can go to www.heart.org and click on conditions. This is associated with the American Heart Foundation, and they can help you with anything that you need.
Thank you, Victoria, for that helpful information. Heart failure can be very stressful, and patients that are diagnosed with heart failure are at increased risk for anxiety and depression that is related to lifestyle modifications that can be difficult to adjust to. It is important to get your family and your support systems involved throughout this process because teamwork does make the dream work.
That's right, Allison. Teamwork does make the dream work. Thank you all for watching today's segment of HBU's Healthy Campus broadcast. Next week's episode will air Tuesday at 4 p.m. Thank you.